The next device that we have is called the Respimat. The Respimat is another inhaled device, sort of like the MDI, but this is a slow mist inhaler. It's called an SMI, but a slow mist inhaler. The Boehringer Ingelheim makes it. You don't need to know the name. Just remember that this is called the Respimat. It will come in a box like this. The placebo Respimat, there's about 4 or 5 medications that come with this, and it will come in a container and with the delivery device. Now, I'm not going to spike this one because this is my last one and I need to keep it for future classes. So what you do is you press the button here, you squeeze it on one side and pull the back off. You notice there's a spike in there. Don't put your finger in there. But what you do is you then take this, put this in, push down, and then push it on a hard, firm surface in order to push this canister, this is where all the medicine is, completely into here. So how's that again? You take this, push the button, take the back off, take your medication canister, put it in there, push on a hard, firm surface in order to get the canister seated. Put that to the side, then it'll look like this. As you can see, the canister is practically flush. You have a counting device over here, just like the MDIs. When it gets down in the red, the patient will have about a week's worth of medication left. Now, you take this, rotate once, it's locked and loaded. The patient will then blow out, pop this, put it directly in their mouth, breathe in and inhale at exactly the same time while they actuate, just like the MDI. So it'll be a blowout, put it in their mouth, and hold for a count of 10, just like the MDI. The difference is you do not use a spacer with this device. Now, utilizing this, you want to twist and then open when they put it in their mouth, and then inhale. You can see the mist coming out. It's just a slow mist. The reason we say that is because what people will do is they'll take it and then rotate, and they just lost their dosage. So that's why you keep this shut. You can't press the button with it shut. And that is a slow mist inhaler. First time you use this, you need to prime it 4 times. That will get the appropriate medication in here. They have built in the primer doses in here. This is the slow mist inhaler. Now, you do not need to use a spacer with it, as I said. The question is, will you use a spacer with it in the hospital? Most likely you will. That is because hospitals employ a process they call common canister, meaning they'll use one canister of medication through multiple patients. What this is the patient does not touch the canister. The patient will touch their spacer device. And with their spacer device, you can deliver multiple medications to or the same canister to multiple patients, just like that. But when the patient goes home, do they need to use this? No. Why are they using this? For infection control, so that you can use the same canister among multiple patients. Not all hospitals have the common canister, but follow the script as it is laid out by the hospital in which you are working. So this is a slow mist inhaler, and more and more medications are coming out with this one.